Hi, so in our session today on June 17th, discussing telehealth for hospitals and critical access hospitals. I mentioned that there was recently a bipartisan bill introduced in Congress called or referred to as the Protecting Rural Telehealth Access Act that would do certain things to make permanent some of the flexibilities for telehealth services that we've received through the COVID public health emergency. So the question was raised at the end of the session regarding restrictions relating to geographic requirements of telehealth. Is that referring to, would this bill remove the requirement that the patient be located in a rural area? Or does that refer to the type of healthcare setting where the patient is located? Primarily, right now, we have a flexibility that allows the patient to be at home. Is that part of this bill? When you look at the bill that I've got pulled up here on the left, it's a little bit hard to read and to understand what these changes actually mean. So for example, it's talking about a language in the Social Security Act where payment for telehealth services outlined, and it says in clause Roman numeral I in the matter preceding subparagraph 1, insert this language. So unless you're really good at doing that quickly while you're looking at the text, I am not. I'm a little bit more visual. What I did over here on the right was pull out the relevant language from the Social Security Act that is being addressed in this bill, and using track changes, I highlighted the changes in red so that we could walk through them and just see how all of this fits together in the provisions of the Social Security Act providing for payment for telehealth. So some of the changes at the beginning of the payment for telehealth paragraph make some changes referring not just to a paragraph 8, but also to a paragraph 9, because it's adding a new paragraph 9 at the end. So I'll show you what the text of that is in just a moment. Same here, referring to a paragraph 8 and a paragraph 9. And then subsection M4. So I'm still within M4 of Section 1834 of the Social Security Act. And this is where the requirements on the originating site are imposed. So this is where we see some substantial changes. Also referencing a paragraph 9, I'll show you that in just a moment. But right here in M4C, there are kind of two components or two restrictions on the originating site. In paragraph little Roman numeral I, it goes into some what I have always referred to as the geographic restrictions, the requirement that the place where the originating site where the patient is located is in a rural area. But also in this M4C paragraph for telehealth services, there is a little Roman numeral 2 or Roman numeral II defining the settings where the patient is that outside of COVID have to be in a rural area. So a physician office, a critical access hospital, the types of settings that can serve as originating sites. And what we see at the bottom of that is that typically, ignoring this red because that's what would change if this bill were to be passed, the patient's home is only an eligible originating site in very limited circumstances. So the vast majority of telehealth is not allowed to be provided to a patient in his or her home. Although during the public health emergency, this is really the section that has been relaxed, allowing the patient's home to be an eligible originating site and also removing the rural requirements of this section M4C of Section 1834 of the Social Security Act, where all the telehealth rules are. So what would change under this bill is except as provided in paragraphs 5, 6, 7 and clause 3, we're going to get a new clause at the end of this here. Originating site means only those sites described in clause 2. So typically that's a physician office, that's a hospital, that could be a skilled nursing facility, a CMHC. And for very, very limited circumstances could have been the patient's home. But we're going to change those sites described in paragraph Roman numeral 2. So ending December 31st of 2020, the patient's home in these limited circumstances is one of those sites where an eligible telehealth individual could receive a telehealth service if they're located in a rural area. But what this bill would do then is after January 1st, 2021, so it's essentially a retroactive statute, the home of the patient would permanently become an eligible setting in which a patient could receive a telehealth service. And then in little paragraph I, if a patient is in an eligible location, physician office, critical access hospital, CMHC, SNF, and from January 1st, 2021 on, the patient's home, if this bill were to pass. There is a new paragraph 3 for January 1st, 2021 and after. The geographic requirements described in clause 1, what I call the rural requirements, would be eliminated. So to answer in a very not so short way, I guess, the question that was raised this afternoon, it would address both of those components for the originating site. So while I had this open, I just went through all of the proposed revisions in this bill, the Protecting Rural Telehealth Access Act, that again is in its very early stages and only just recently introduced to Congress, but it is, as we discussed, bipartisan. So that suggests that it may have more support than other bills. And I went through other sections of the Social Security Act that would be modified by this bill, so we can take a look at what those changes would be. Okay, so again, it would allow us to provide telehealth to patients at home, regardless of whether they're in a rural area or not, on or after January 1st, 2021. Okay, just a couple little technical provisions there to reference both a paragraph 8 and a paragraph 9. There's going to be a new paragraph 9 I'll look at in just a second. The other piece of this that I mentioned during our session is that it would allow for store and forward technology to be used to deliver telehealth services. And so this is where that piece of the bill comes in. A lot of technical language here, notwithstanding these regulations or their successors, the term telecommunications system can include the following. The term can include the following, subject to the clause 5, the term telecommunication systems include a communications system that uses audio only. So this is essentially getting rid of the audio visual component and would create, as part of the definition of a telehealth service, phone visits. Now, right now, phone visits are covered, and on a temporary basis, they are considered a telehealth service. Although outside of the public health emergency, they would not meet the definition of a telehealth service because they are not audio visual communication technologies. This would remove that requirement, making permanent the use of phone call visits a type of telehealth service. And that, I think, really opens the door to coverage for a lot of services and items described by CPT codes in our book that previously could not be considered to be added to the telehealth list because there was not necessarily an audio-visual component to it. So audio-only technology would suffice to be telehealth if this bill were passed. Let's see, specified telehealth service, if it's furnished by a qualified provider, and it goes on to define what that qualified provider definition is here. Telehealth is evaluation and management services. So that what that means to me are that this This encompasses services within the entire evaluation and management section of the CPT book. Right now, not all of those services meet the definition of a telehealth services, and not all of those CPT codes are on the list of eligible telehealth services. So that I think also would open the door to a lot more items and services being added to the list as eligible telehealth than what we currently have. Behavioral health counseling and educational services. I got my CPT book out because I'm looking at the second item, behavioral health counseling and educational services, and what that would mean to me from a coding perspective. And in our code book, we've got a whole section with a whole section category, I should say, within the medicine section of CPT for psychiatry services. But behavioral health is even broader than that, and educational services are even broader than that. So we have, for example, I'm looking at a category of education and training for patient self-management in the CPT book. That could be education and training for patient self-management using a standard curriculum. These types of services that are education or counseling could, on a very broad level, then become eligible to be telehealth services that right now may not currently be on the telehealth list. And then other services determined appropriate by the secretary, that would then defer to the kind of request and review process that we have on an annual basis right now, where commenters and the public can submit requests for items or services to be added to the telehealth list, and why. And the secretary has a very specific review process to determine whether or not those items and services meet criteria as telehealth. But because this bill, if passed, would specifically encompass E&M services, behavioral health counseling, and education, if passed, then the public and commenters could then indicate a service is an evaluation and management service because it falls within the evaluation and management section of the code book, and that may be a mechanism to get more services approved for payment as a telehealth service. It will also become critical year to year when the American Medical Association is updating the CPT book to look at where codes fall in the book. If they fall within the medicine section, that may not mean the service could automatically be provided via telehealth, but if they are classified within the E&M section of the CPT book, that is a service that could then readily qualify to be provided as a telehealth service, if this bill passes. Okay, so then it goes on, the bill would go on to define who a qualified provider is. And if I go to the very end of the bill, there's a statement, kind of a sense or a policy statement, that all of the types of healthcare professionals who have been added as eligible professionals to deliver telehealth during the public health emergency should be permanently made to be eligible professionals for telehealth services. Therapists are one of the biggest categories that I think of when I see that policy statement. So physical therapy, speech therapy, occupational therapy that previously were not allowed to deliver telehealth services, and were actually not allowed until pretty late in the game. I want to say sometime last summer, were allowed to provide services via telehealth. So this bill then would redefine who or what constitutes a qualified telehealth provider, and that means a physician. They're currently able to provide telehealth, but they're adding this caveat: who has an established relationship with the individual as determined by state law. So state to state, the point in time that you have a provider-patient relationship may differ. And so we would want to look at our state laws for that. It would also mean, though, that it could be a critical access hospital, an RHC, an FQHC, a hospital, or CAH-based renal dialysis center, skilled nursing facility, a CMHC, or rural emergency hospitals that have established relationships with patients could also be qualified telehealth providers. Let's see, secretary can determine whether it's appropriate to furnish a particular telehealth service via a communications system, and that term would be modified to include not only audiovisual technology, but just audio technology, and whether an in-person initial visit would be required prior to furnishing that service. That's a requirement that we see for some care management services to be provided as telehealth. They are covered as telehealth with the caveat that you may need an in-person visit first before the item or service being covered as a telehealth visit. Clarification regarding payment. The amount of payment for any telehealth service furnished using audio-only technology must be equal to what that service would have been paid if it was furnished via any other telecommunications technology like audio-visual. Because this act is called Protecting Rural Telehealth Access Act, I envision the intent of that being protecting individuals who may not have a solid internet connection for audio-visual communications like Zoom or other web-based technologies. I mean, I'm in Johnson County, Kansas, and sometimes my internet's not fast enough to accommodate some of those technologies for whatever reason. So I noticed last summer when kids were home, and there was a lot of this summer, kids are home streaming shows during the day in the neighborhood. And I tend to have some slower access issues where audio visual can be challenging. So when the internet connection is poor, unreliable, this is protecting access to telehealth services to individuals. And of course, in rural areas, that's going to be a much greater issue than in urban or metropolitan areas. So continuing down to some of the other changes that this bill would effectuate if it were passed, not only during, but also after the emergency period. It describes payment for telehealth services for FQHCs and RHCs. And in doing that, describes that the payment methodology would be 101% of costs for critical access hospitals when a telehealth service is furnished by an FQHC or an RHC. Then the service should be reimbursed as a separate telehealth payment, not included in the all-inclusive rate, right? Or the prospective payment system rate, depending on whether you're an FQHC or an RHC. Implementation, that there's going to be a coding system to make that happen. For purposes of FQHCs and RHCs, a qualified provider would mean it's furnished to an eligible telehealth individual, an FQHC or an RHC that has established patient relationship in accordance with state law. So then there's some added language. Remember, we saw above there were references to paragraphs 8 and we would add 8 and 9. Paragraph 8, we added and 9. So there are new provisions in paragraph 9 of the telehealth payment statutes that are specific to critical access hospitals. So we add all of this language here that's similar to the way this bill would redefine a qualified provider of telehealth services and for FQHCs and for RHCs and for hospitals. For purposes of critical access hospitals, a qualified provider, when providing a telehealth service, can be a CAH that has an established patient relationship in accordance with state law. And then for critical access hospitals, payment would be 101% of reasonable costs. And then some instructions to the secretary on how to implement those rules. So that is the long answer on what this bill would do to the Social Security Act provisions for changing telehealth services. And because these would be statutory changes, they would, if implemented, become permanent changes to the way telehealth is defined by Medicare at a federal level. And some of these provisions would be retroactive to January 1st. So there would be no gap in coverage for patients at home, for patients outside of rural areas, and then expanding who can provide those services on a permanent basis.